Hey everyone, Dr. Rob here. I want to take a moment to spotlight my sponsors, Professional Co-op, empowering clinicians with premium access to top-tier lab services at a fraction of the cost. Since 2001, Professional Co-op has redefined what efficient, patient-centered support should look like. No hidden fees, no minimums, and you only pay for completed tests. It's lab access made simple, transparent, and affordable. Trusted by licensed healthcare professionals across the country, Professional Co-op is your strategic partner in delivering high-quality care. Discover more at www.professionalco-op.com. A quick shout out to my other sponsor, Functional Medicine University, one of the top online programs for learning functional medicine. Founded by Dr. Ron Grisanti, FMU has trained thousands of healthcare professionals in over 50 states and over 68 countries. It's completely online, self-paced, and CE approved for a wide range of clinicians, MDs, DCs, NDs, PAs, and more. At the end of the program, you earn your certified functional medicine practitioner credential, something that's truly elevated my clinical approach. If you're ready to level up your practice with evidence-based root cause care, FMU is the place to start. Check them out at functionalmedicineuniversity.com. As a practitioner, I only use products I believe in, and Nutridyne is at the top of that list. What I love about Nutridyne is their unwavering commitment to quality, transparency, and science. Their products are practitioner exclusive, which means they're built specifically for clinical use. That matters when you're trying to get real results. From foundational support to condition-specific protocols, I've seen firsthand the difference Nutridyne makes in my patient's health and in my practice. Hey everybody, Dr. Rob Silverman here. I'm with a luminary in functional medicine and chiropractic. I'm excited because he is a chiropractor and he does functional medicine. 37 years of clinical practice. You got it. 37 years. Dr. Ben Weitz. Ben, what's up? How are you today?
Thanks, Rob. I'm doing great. Looking forward to another day.
Yeah, this is going to be fun. So you're on the West Coast, I'm on the East Coast. So let's see if we can
Yep,
get two coasts to meet. Let's just
you
get
got
shoot
it.
right out of the box. What drove you into functional medicine?
You know what? I've always been very interested in nutrition from my beginning time in chiropractic. And before I did chiropractic, I did bodybuilding and I learned about body composition, how to get my body fat low for bodybuilding contests and how to manipulate the diet and the exercise and the lifestyle. So I was interested in nutrition long before I got into chiropractic. And then when I got into chiropractic, I thought, wow, this is great. This whole profession is going to be focused on nutrition. And then I went to my first day of chiropractic school and there were a number of like overweight people smoking cigarettes, eating donuts. And I was like, what the hell?
Yeah, not everybody in chiropractic is sinewy, without question.
No.
It's kind of funny. Everybody thinks that chiropractors know a lot about nutrition coming out of chiropractic school. That may not be the case. We don't get a lot of classes. It's just something that we adapt to, that we add into our
Well,
armamentarium.
put it this way, we get a lot more training in nutrition than medical doctors ever do,
True,
but
true.
absolutely true. I learned a lot more about nutrition outside of chiropractic than I did inside of chiropractic, though learning about biochemistry and
Right.
physiology and things like that are very, very important to understand the effects of nutrition.
Right. Without question, our chiropractic background really lends us into doing nutrition, supplements, weight loss, things like that. And you would think the medical education also lends them. They're very heavy in biochemistry, organic chemistry, and the like. It's just that in the functional medicine world, that's populated by more non-medical type practitioners than medical practitioners, though that is changing every day.
And the biochemistry in medicine is really more geared towards A, life saving, and B, how can drugs affect
Right.
physiology?
Right. So we both know and both had on a podcast a couple of times the father of functional medicine, Dr. Jeffrey Bland. I was fortunate enough to have him write the foreword for my book, Immune Reboot. He has coined a phrase, root cause resolution, and it took the world by storm. I think there's one addendum to that right now, and I'll let you run with this: root causes resolution.
I've always been a huge fan of Dr. Jeffrey Bland. Some of my earliest training came from he used to give an annual seminar as part of metagenics. And I would go to that seminar every year, and my neurons in my brain would come out all frizzled and stimulated, starting to understand this new way of functional medicine, a new way of understanding the body and physiology and health, and not just thinking of the body in terms of disease, and how do we help people to become healthier and understand their microbiome and the different processes that are involved in promoting health. And he came out with a audio tape series long before podcasts. I used to get this cassette tape every month. I would stick it in the car and listen to it on my way to work or wherever I was going. And so I was a big fan of Dr. Jeffrey Bland for many, many years. And we owe a lot to him as a guy who blazed a trail and took many barbs from the medical profession and quack busting people and everything else.
You know, every time I see him speak, till this day, actually, I think of a quote by Sir Oliver Wendell Holmes, and he said, "A mind stretched by a new idea never returns to its original dimensions." And I definitely have stretch marks because of him.
Yeah, absolutely. Unfortunately, the medical profession changes very slowly. On the average, it takes 17 years for a new idea to be incorporated into medical practice.
I'm going to skip over that one. I don't want to go on Quack Watch or Bang or whatever they do. That said, you know, interesting that many people went into functional medicine because of something that happened to them, or they really get a resolution from something that happens to them because of functional medicine. Now, let's take us back. Let's turn the clock back to, I think it was Halloween in 2023. Something happened to you.
Yeah, so I want to preface this by saying I was really invested in functional medicine, and I never had a health crisis. And I remember going to seminars on speaking, saying you have to talk about your health crisis so you can get your talk, your TED talk. And I was like, I don't really have a health crisis, even though I'm a big believer in functional medicine and nutrition. But I had my health crisis in Halloween of 2023. I was handing out Halloween candy. I had a bowl of Halloween candy in my right hand. I had the dog's leash on my left arm because I would open the door to greet the kids for the Halloween, and the dog would want to jump on them and lick them and stuff. So I had to hold the dog back. And I was walking backwards, and the dog pulled. I had socks on a wood floor, and my leg slid, and I just right down on my greater trochanter on my right hip, and I fractured my proximal femur. And that was the beginning of my health crisis.
Now, that's a bad injury. You know, that is a life-changing type of fracture. It's one of the ones that people, and you don't look your age, you know, don't come back from. Falls.
Yeah, I think 25% of people who fracture their hip die, never recover.
So what was the conventional methodology that you offered?
Well, so I went to the emergency room, and I ended up getting surgery the next day, and they put two steel rods in, one going up, one going down, that were connected inside the femur, and that was supposed to get it to heal. Unfortunately, after that surgery, ideally, the two bones would be flush up against each other, making it easy for new bone formation. Unfortunately, in my case, there was a gap separating the two bones. So that made it a lot more difficult for the body to put collagen cross fibers and lay down calcium to create new bone because there was this gap. So I would go in each month and get another x-ray, and every month there was still a gap. So after 4 months, doctor said, look, this is a non-union. It's not going to heal. I sought opinions from several different orthopedic surgeons about what to do. I was seeing my primary care doctor and considered the options. And so, the options would be to possibly go in and try to modify the surgical procedure in some way to maybe get it to heal, or get a new surgery, get a hip replacement. People recover from hip replacements very quick. But I didn't want to get a hip replacement because even though I had this fracture that was close to the hip joint, my hip joint is fine. I have good cartilage in there. And if you get a hip replacement, you take that cartilage out and you put a piece of plastic in, which is going to wear down compared to the piece of metal. So I didn't want to do that, even though that might have been an easier course of action. It was advised to me that I needed to get revision surgery, that they need to go in and pull out these two rods that were inside my femur. And then this particular doctor in LA, who's the expert at hip revision surgery, has developed this procedure where they have this steel rod that goes down the outside of your femur with a bunch of screws that go all the way down. And I looked at this procedure. I looked at the design of what would happen, and I told this orthopedic surgeon, who's a respected orthopedic surgeon at one of the respected clinics in the area, that there's no way I'm going to do that. And he said, well, if you don't do that, then eventually the hardware will fail and your leg will collapse. And I said respectfully that you don't know that that's going to happen, and I'm not ready to do that procedure to begin with. To try to pull those steel rods out from inside my femur, you're going to have to chisel those out, and then I'm going to have a hole in my femur, and you can't lay down new cement or something. And then I'm going to have this steel rod down the outside of my femur. I'm going to have to start all over, not being able to sleep because of the pain, not being able to walk and everything else. And I was slowly improving functionally. So I knew that some form of healing was occurring. Of course, there was a question, which was if some fibrous tissue was starting to be laid down across the bone, was this a good thing or a bad thing? And interestingly, different experts had different opinions about that. And so one opinion was, if you get a bunch of fibrous tissue, that can interfere with bone healing. And I talked to my primary care doctor, who told me about some non-union he had in his wrist where they had to clear out the fibrous tissue to get the bone to heal. And then I talked to other prominent experts, including the head of physical therapy at USC. And he said, no, the body's trying to lay down bones. So first it puts fibrous tissue, and that provides the collagen framework to then lay down bone because it's got this challenge. So I knew I had a challenge, and that it wasn't healing according to the normal course because of the fact that there was a gap. And I didn't want to get another surgical procedure. So I came up with a plan. So I had, because I have my own podcast, Rational Wellness, I had a number of discussions about bone healing and osteoporosis. And I knew about some of the medications and treatment strategies for helping bones to heal. So I knew about this drug called Forteo, which is it's considered to be an anabolic bone drug. So there's basically two categories of medications that can be used to help heal bones and to overcome osteoporosis. So we have, when it comes to bone physiology, we have these two types of cells. We have osteoblast cells, which create new bone, and we have osteoclast cells, which break down bone. And this occurs throughout our life, and there needs to be a balance. So we have most of the drugs that people take for bone, for osteoporosis, to help bones to heal, are these drugs that block the osteoclasts. So we have a big category of drugs called the bisphosphonates that a lot of people utilize, and these are often the frontline treatment. Prolia is also a anti-resorptive drug. One of the reasons why I'm not a big fan of those drugs, especially for bone healing, is that we need to have healthy bone. And so what those drugs do is they block what essentially is the cleanup crew. So what happens in normal bone physiology for just somebody walking around is that you actually break down a certain amount of bone. When you work out, you break down muscle. Just normal activity, you break down a certain amount of bone. And then the cleanup crew, the osteoclasts, come in and clean up that junky bone, making it easier for the osteoblast to come in and rebuild the bone. And that process is how we get good, healthy bone. If you block the osteoclast, you will end up with more bone, but you're not going to clear out the junky bone. And I knew I needed good, strong, healthy bone, not junky bone. So I elected to get a prescription for Forteo, which is an anabolic bone drug that stimulates osteoblasts to lay down new, fresh bone. I found a meta-analysis that showed that this medication has been shown to be helpful in patients with femur non-union. And I got my the surgeon who originally did the surgery to write me a prescription for that. I wanted to get my body in a bone healing environment as much as possible. So I looked at medications, what else could possibly help. And I talked to a number of my friends in the functional medicine world, and a number of them said, look, you got to get on some growth hormone because that's going to put your body in this growth healing environment. Growth hormone stimulates bone formation as well as muscle formation. So I got a prescription for human growth hormone. The surgeon, he wasn't so thrilled about it, but one of my functional medicine friends gave me a prescription. And so I started taking an injection of Forteo every day. I did it for 5 months. I did 5 days a week, 2 IUs of human growth hormone. And I got a bone stimulator machine that works with a pulsed ultrasound that I put over the area twice a day for 20 minutes. And then I from the beginning, I made sure that I got all my supplement program in place to maximize bone healing.
Right. You know what? Let me interject because it's a really good point here in that everybody thinks that functional medicine is just taking vitamin D and omega-3 fatty acids, and it's not. The premise is whatever works once you figure out the root cause resolution. And the idea of integration is the next chapter in the functional medicine story. So people want to know, why didn't your bone heal? I mean, obviously it healed when you did all these things, but why wasn't it healing appropriately to start?
Because there was a gap, and that created a challenge for the body. If those bones were touching each other, it would have been very easy. Imagine that you have a cut and the cut's open. How do you heal it? Well, you get stitches to hold the two parts of the skin next to each other. That facilitates the healing. In my case, the bone was separate, and there was nothing I could do naturally to make that happen. Now, of course, I did as much of the rehab as I could possibly do from the beginning. I mean, as soon as I got out of the hospital, I was in Gold's Gym on my walker doing upper body. I was not going to lose strength and muscle mass just because I had this fracture.
Wow. Now, you were referring to the idea of supplements. Which supplements were you taking? I'm sure there's a litany of them.
Yeah. So when it comes to bone, vitamin D is crucial. Now, I've always taken vitamin D, and I always take vitamin D with K. I normally take 5,000 units of vitamin D, and that usually keeps my vitamin D level, my 25 hydroxy D level, somewhere between 45 and 60. And I get it up to 60, it drops down to the 40s. So I decided, let's just go a little heavier on this. Let's try to get it up to 70 or 80. So I took 10,000. And then I started taking a high dose MK4. So vitamin K has two forms. We have vitamin K1, which the vitamin D incorporates K1, and vitamin K2. And for vitamin K2, there's two forms. There's MK4 and there's MK7. MK7 has gotten most of the attention in recent times. It's been heavily marketed. It's actually a lot more expensive. It may have some cardiovascular benefits that haven't been shown in MK4, but when you really look at all the data on vitamin K, the most robust data on bone health, on bone density, on fracture prevention is with MK4. And a lot of these studies were done in Japan, where MK4 is sold as a prescription drug, and the dosage that's used is 45 milligrams. And most people are taking an MK4 or an MK7 in somewhere in the 100 to 200 microgram level, which is 1/10 of a milligram. So this is a much higher dosage, but that's what's been shown to be most effective. By the way, vitamin K2, not only does it help with bone healing, it reduces the potential risk for calcium buildup in the arteries and the other soft tissues. So super important nutrient, and I don't think it's gotten enough attention. And I think the data shows that MK4 is really the form that vitamin K is stored in most of the tissues, and probably should be the preferred form for most uses.
Now you're going against conventionality there, because MK7 is the hot one, but
I know.
it's okay. It's great.
Yeah. By the way, the promoters of MK7, one of the things they say is this lasts longer in the bloodstream. And you know what? That sounds great. But do you want the vitamin K in your bloodstream, or do you want it in the tissues? And having a lot in your bloodstream could mean it's not getting absorbed into your tissues. And if you look at the body, the form that vitamin K is stored in most of the tissues and organs is MK4.
So we'll start with D3. I agree with you. The average person, or the marker that the medical field looks at, is plus 30. And we know 60 to 80 and maybe 80 to 100 is the sweet spot. So
I know. I just had a patient of mine who's our primary medical doctor. Their lab range has 30 to 60, and she had 62. So they told her she has to stop taking all her vitamin D.
Yeah, no, not happening. Mine happened.
And she has, bone density issue problems. No
surprise. So vitamin D3 with vitamin K, K2, they're the dynamic duo. They're the perfect match. There's a debate between MK4 and MK7, but I do agree with you. MK4 has got a lot of data for bone. MK7 definitely data for cardiovascular. I believe that vitamin K is where we were with vitamin D, say 10 or 15 years ago. It's going to be the new girl with the curl, and people should take it in conjunction. And just to expand upon the theme about the idea of vitamin K and plaquing, you have to take K with D, so D transports calcium to the bone and not to soft tissue. And that's the secret recipe for its success for that.
I agree, 100%. Any program to reduce cardiovascular risk should be incorporating vitamin K2.
Now, what other supplements did you incorporate for bone health? This is going to get interesting.
So I added boron. I added 2 milligrams twice a day.
Excellent.
I added calcium, magnesium. Like a lot of people, for years I took calcium, magnesium, and then these studies started coming out saying that if you take calcium, it's going to increase your risk for calcified plaque in your arteries, and it's bad for heart. The reason why they were doing studies on calcium and cardiovascular conditions is because prior studies had shown that calcium reduces hypertension, that calcium is good for the heart, and all of a sudden calcium's bad, because the problem why you get plaque in your arteries is because of calcium. And I think this was just completely wrong from the beginning.
Without question. Now, when you say calcium, magnesium, what's the ratio between calcium and magnesium?
Okay, so I usually take 1-to-1, but that's partially because I tend towards constipation, and magnesium is a stool loosener. But for a lot of the patients with osteoporosis, I recommend 2-to-1.
Let's get a little more granular. Which form of calcium, which form of magnesium do you prefer?
Yeah, so I don't like calcium carbonate because that's the least absorbable form. Limestone, yeah, that's no good. I grew up on the idea of hydroxyapatite, but I don't really think there's enough data to show that that's really the most beneficial form. So I think there's a number of absorbable forms. I think citrate, malate, several other forms like that I think are easy for the body to absorb. Possibly using several different forms is good. So I use a citrate malate combination.
Okay,
And
great.
and then I also used something that's kind of controversial, which is strontium citrate.
Sodium boost.
Yes, exactly. You got to take it separate from your calcium. Some people say that strontium is not beneficial, that it just replaces calcium. In my case, I wanted to get some bone in there. And if that bone happened to be strontium or calcium, I just needed some bone in there. And I was happy with filling in that gap, whatever it took. So I took some strontium as well. I also added collagen, which I've always sort of taken, but not as regular. I made sure I took collagen every day because collagen is the matrix that bone is formed on. And then I also added glucosamine and chondroitin, which I've taken off and on most of my life anyway. And it turns out that those are also beneficial for arteries and heart health.
You know what's funny about glucosamine and chondroitin? It's been around since the hills were first created, but it's effective. And I think it has the second most amount of studies behind it after like a vitamin C. So, it's kind of like Novocaine. It works every time.
Right. By the way, I made sure I took some extra vitamin C. Vitamin C gets forgotten. If there's ever a forgotten nutrient, it's vitamin C. And people like, oh yeah, it's just vitamin C. But vitamin C is synergistic in bone formation in almost every health aspect of the body. Vitamin C plays a role, collagen formation, etc.
Love the idea of incorporating collagen. I put it in my coffee every day because it does not decompose due to hot aqueous solutions. Collagen is a great choice. Skin, hair, and nails, bone, gut, etc. Now, for me, I was curious, did you use any BPC 157? Because I'm a peptide guy.
I took some orally. I didn't take an injection. I looked into injections into the bone. And I talked to two different doctors who specialize in injections about possibly injecting peptides or injecting stem cells into the gap. And they both said, oh yeah, it makes a good idea. And neither one had any experience with a patient who had a non-union where it was beneficial. So I was a little hesitant about sticking a huge needle into the center of my bone unless somebody had some confidence that it would help.
Yeah, I use the BPC in an oral form, BPC 157. I find it stacked with KPV, another peptide, and TB4 frag does great or has a great effect on healing.
And you take all of those orally?
I take them all orally. I like the orally. Yeah. It's funny. We've all got into the idea that the injection is 2 to 3 times better, but the injections are better because of its placebo effect. When you break down that placebo effect or take it out, it's only a few percent improvement over the injection. And with the injection now being unregulated, you and I get a little nervous about injecting things that are not regulated. You and I may not send a Christmas or a Hanukkah card to the FDA, but there still needs to be some oversight and some regulation in healthcare. Otherwise, the bad guys may run the show.
Absolutely. I would be a little nervous about just ordering some injectable drug on the internet and just injecting it myself, not really knowing the quality or the testing that went into the safety of that.
Now, interestingly enough, you use supplements. How did you determine, I'm not asking you to know what companies you use, how did you determine which companies to use, the quality of the company? Because everybody calls me and they'll go to an online store and say, I got 350 companies. Everything's the same. And you and I know, no way. We've discerned that there's only about 10 or 12 companies that we prefer.
Well, first of all, I scrupulously look at all the ingredients, including the non-essential ingredients, and see what kind of excipients and binders and things like that.
Great.
So I make sure that we have a company that doesn't use those. I make sure the company tests all the raw ingredients that come into that before they put it into the products. A number of the companies I've gone and inspected, their manufacturing facilities. I've gone to Metagenics, I've gone to Designs for Health, I've gone to a number of these companies and, put the suit on, the hat and everything and looked at their manufacturing facilities. So I have confidence that these companies have the highest integrity, and we only use companies that are professional brands that sell to practitioners. So and then I make sure I get the exact ingredient and the exact dosage, and make sure it's coming from the highest possible source.
Right. I concur, because so many patients, they don't know where to go. They think they can buy what we have analyzed and what we carry and think it's all the same, and it's just not. And I think that that's one of the battle cries that many practitioners need to share, is that they've done their due diligence, and what's on the bottle matches or what's in the bottle, I should say, matches the label. So let's turn a page now. Obviously, the number one conversation piece is longevity. You were concerned about your musculoskeletal longevity. So let's talk about this thing called mTOR. It's one of those ideas. I think it's the girl with the curl. Some people want to turn it on. Some people want to turn it off. I believe it's the Goldilocks effects, just hitting it just right. Why don't you take the baton and go with it?
Yeah, no, I definitely agree with that. And during this period of time when I was trying to get the bone to heal, I needed to ramp up mTOR. I need to put my body in a growth mode. But there's a number of practitioners in the longevity and lifestyle space who promote inhibiting mTOR with the worry that when your body is in that growth stage, that it may increase cancer risk. The fact that cancer cells that are there in your body may start growing faster and overwhelm your immune system. I don't think there's been any research to show that it would cause cancer to form, but our body typically forms cells that are dysfunctional, and normally the immune system wipes them out before they create a problem. And when that happens, that's when you end up with cancer. So there's a number of practitioners or doctors, researchers who promote eating, for example, a lower protein diet, because protein has been shown to increase growth factors. And one way to measure this is to look at IGF-1 levels in the blood, which is a proxy for growth hormone. And you mentioned mTOR. That's a signaling molecule that increases overall growth in the body. And so if you can ramp that down, you may decrease cancer risk. Some researchers point to dwarfs in Ecuador, the Laurent dwarfs. And the Laurent dwarfs have no growth hormone as a result of a genetic defect. And they also have virtually no cancer. So this is an argument that ramping down growth, ramping down mTOR, ramping down IGF-1 is a good thing for longevity purposes. And some people on an experimental level are using a drug called rapamycin, which has been on the market as a drug that suppresses the immune system. It's been used for organ transplants. And so they take it intermittently to ramp down mTOR to promote longevity. And there's animal studies showing that it's promoted longevity in animals. And there haven't been too many drugs or substances that have consistently been shown by themselves to promote longevity. Now, let's look at the longevity space and what else do we have about whether it's good to have growth or no growth. Well, we also know that one of the biggest reasons why people die when they get older is they fall and break a hip, or something like that. And so the loss of muscle, sarcopenia, the loss of bone, osteopenia, the shrinkage of the thymus gland, thymus involution, which means your immune system gets weaker, which means if you get an infection, you're more likely to die. You're more likely to die from COVID or the flu, etc. So these things are a huge threat for longevity. So if you decrease mTOR, you're increasing the risk for those things. So therefore, the argument is no, we need to make sure that we continue to have new bone formation, new muscle formation, that our thymus gland continues to be healthy, that our immune system continues to be healthy, that we have growth happening even as we get older. And so the first study that was actually done that showed a reversal of epigenetic aging, which was the phase study, the interventions that were used were growth hormone, metformin, DHEA, zinc, and vitamin D. And so for a long time, the longevity space, there was a lot of focus on using growth hormone, testosterone, things that promote growth. Now the field seems to be more dominated by the opposite, by ramping down mTOR, by taking rapamycin, by using intermittent fasting, by promoting what we call breakdown, what things that promote the breakdown of old broken down cells called autophagy. In the mitochondria, it's mitophagy. So we want to promote getting rid of broken down and so rather than just formation. So that's been a lot of the emphasis. But as you alluded to, there needs to be a balance. We can't just ramp down growth and mTOR. And if you get weaker, your bones get weaker, that's going to be a bigger threat to longevity than anything else. So we need to have both a balance between growth and rebuilding, as well as not excessive growth and rebuilding, and also intermittently doing things like fasting and sauna and putting your body under stress with exercise that helps break things down, and so we can rebuild.
You got my whole list of longevity hacks here. So great. Really to tie in the idea of sarcopenia, Tufts University, 1998, did a study and found the first sign of aging, as you said, loss of muscle mass, sarcopenia. Gabrielle Alliance does a great job, muscle mass, longevity organ. Mark Hyman says, muscle mass is the currency of longevity. We need to be able to turn on a little bit of mTOR to have muscle mass from muscle protein synthesis, because we want to stimulate that by consuming protein and doing weight resistance. Really good point about osteopenia.
Who wants to live a long time and you can't get out of your chair?
Right. Did you know there was a study that just came out that the number one marker for longevity was our movement or our movement dysfunction? So who better than a chiropractor who's trained in the idea of functional medicine, functional nutrition, and chiropractic movement as a longevity doctor? I'm still waiting for a better answer.
Yeah, and it's interesting. Some of the smartest people in the functional medicine world actually are chiropractors.
Without question. And, you know, it's what's beautiful about the functional medicine world is that it's truly integrated. You know, we're sitting with medical doctors from Harvard, osteopaths, physical therapists, nutritionists, and the like. And we're all getting it from different vantage points. And, you know, we're able to helicopter in and really get to that root cause. And I think everybody should, when they go to the doctor, obviously, if you have shortness of breath and pain going down your arm, you might not ask why. You need to tend to it. But at a certain point, you want to ask, why do you have this set of symptoms? Because if you didn't ask the question why, or, you know, do it on your own, you may have not healed your bone. And that's not saying the medical doctors don't have it. No one has the answer. That's why we call it integration.
Right.
So I got a couple other longevity questions for you. You spoke about sauna. Is that just hot, or is that hot and cold that you want?
I think hot and cold, things that put stress on your body, whether from temperature, whether from exercise, are good. It produces a response in the body where the body reacts and gets stronger and improves.
They call that hot and cold shock proteins. I'm more of a sauna guy than a cold guy. You know, I see Mark Wahlberg, Marky hates that. And he's jumping in ice. If he wants to freeze his fortitude, go for it, dude. And I'm all for it. But the hot, and you want it between about 146 to 175 degrees to stimulate heat shock protein. And really to, you know, highlight the point you just made. We're good when we're slightly stressed. We cave when we're extremely stressed.
Right. Absolutely. We need controlled amounts of stress. That's what
Now,
exercise is. Exercise is a controlled amount of stress you're putting on the body.
now, exercise. Let's talk a little bit about it. What kind of exercise do you recommend? Weights, cardio, combination, and if so, which one first?
We need to do both. Actually, there's more data on the benefits for longevity of resistance exercise,
Mhm.
weight training. And when it comes to bone, if you want to increase your bone density, you have to do heavy weights. And unfortunately, you can't use 2 pound weights that you just swing around.
Right, I agree. And
You
that's
know,
for men
there's
and women. That is for men and women. There should be a
absolutely
resistance
for
training
men and
program.
women. So you got to do heavy weight training. You got to push heavy things. You got to pull heavy things. You got to put your muscles and your bones under stress. And then the body reacts by making those muscles and bones stronger. And then
Right.
we've got to exercise our heart and our respiratory systems. So you got to do some cardiovascular exercise, whether it be running, walking, getting on a elliptical machine or a treadmill or et cetera, et cetera. You can even do lighter weights quickly going from set to set and do a high intensity routine. But that doesn't take the place of also doing some heavier weights where you need some rest in between sets.
Right, I agree. You need to do both men and women. I think men rely on weights a little too much. Women sometimes traditionally rely on cardiovascular. New data just came out that spoke to the idea you should do the weights before the cardiovascular if you're going to do both on the same day. Because if you do the cardiovascular, you lose all your glycogen and you won't be able to push optimally. And it's more important to push optimally.
Absolutely. I've been telling people that for years. And a lot of people will come in and do their cardio first to warm up. And as you just mentioned, you want your maximum glycogen, which is the storage form for carbohydrates in your muscles. That will allow you to lift the most weight. So you do your weight training when you're fresh. Now, if it's really cold out and you want to get on a bike for a few minutes to warm up, that's fine.
Mhm.
But you don't want to do an extended cardio session and deplete your glycogen. On the other hand, when you're doing your cardio, you want to try to maximize your fat burning. And you don't burn fat until you burn off the glycogen and then you start burning fat. That's why they always say
Great
your cardio
example.
has to be at least 15 or 20 minutes before you burn fat. Well, if you do your weight training first and you deplete most of your glycogen, then you're going to be burning fat quicker when you do your cardio.
Outstanding. That was the exact example and the reasoning behind how they said you could put some muscle on and then store fat, burn fat, excuse me. So Hippocrates once said, let food be your medicine, let medicine be your food. What foods do you recommend generically to people before you can individualize and personalize it for the person sitting in front of you?
Well, I mean, it depends on the purpose, but just in general, for overall health, everybody should be eating a variety of different colored vegetables and fruits. And I say vegetables and fruits because between fruits and vegetables, you want to emphasize the vegetables, not that fruits aren't beneficial as well. And then number two, you want to make sure you're getting quality protein. And I think the best way to get quality protein is to include some high quality animal protein. But I know some people are wedded to the vegetarian idea, and you can also get your protein that way. You probably, for maximal protein, you probably need to add some supplemental protein powder, add some extra soy, but you got to get quality protein. That's how you rebuild your muscle. It's also important for rebuilding bone. You got to get healthy fats, and that means omega-3 fats. There's also benefits to omega-6s, even though omega-6s have been under assault recently because
Tremendous
people
assault.
call them seed oils, and there actually are benefits to omega-6s. And then there's some other types of fats as well. So make sure you're getting some healthy fats, have some extra virgin organic olive oil, have some avocado, have some nuts and seeds, and make sure you're getting plenty of fiber. We need fiber for the microbiome.
Absolutely. I love the plant or they'll call it the plant versus the meat, the carnivore versus the vegans. It's unbelievable. It's hysterical. I just look at them and I just say, do you think maybe if we took a little here, we took a little here and put it together, that would work? You know, it's funny. I was talking with my mother-in-law. She's visiting for 7 weeks. I'm having a great time, everybody. I adore my mother-in-law, and I'm saying that in a serious note. She's fabulous. And she said, How do
Make
you
sure you
choose the
score some
food?
points with your wife right there.
Right. Yeah. Actually, my wife's not here today, but she may watch it. So she said, "How do you choose your foods?" And my mother-in-law is very, very religious, carries the Bible around, and she's a big believer. And I said, "You know what? If it walked in this earth and God gave it, it's healthy." And she looked, snapped her hands, and said, "You got it. Go with it. Say it on your podcast. Say it when you speak." So there it is. Hallelujah. I said it. But the point is,
I agree. Anything Jeffrey Bland says is good.
I concur. So basic premise I noticed you didn't speak about was you don't include any ultra processed foods. Outstanding. What about sleep? Let's close with a great longevity hack, one that you should be able to control.
Sleep is super important. It's harder to control. So many things go into getting a good night's sleep, but you need to get uh, a good amount of sleep. You need to make sure it's quality sleep. Like everything, quality is as important as quantity. So you need to make sure you have plenty of deep sleep and REM sleep. It's probably a good idea to track your sleep by using an Aura ring or something like that. And there's a number of things that go into getting a good night's sleep, including having your room dark and cool, having a sleep routine,
Mm.
avoiding blue light in the evenings, etc. But sleep is super important for rebuilding, for clearing out toxins from our brain, for many, many reasons. Sleep is crucial for recovery.
Now, I always love to end with the one tangible takeaway that people can utilize if they go through the whole podcast and say, okay, give me the one thing. We live in America. So, what's the one thing that you want everybody to do on Monday morning that's different to imbue them with enthusiasm to start a healthier lifestyle?
Lift heavy weights.
All right, I love it. Lift heavy weights. Is that biceps and triceps or is that full body weights?
Yeah, do a 5-rep maximum deadlift.
I love it. I won't ask if it's Romanian or Jefferson deadlift. We're good. There you have it, everybody. It's been my pleasure, Dr. Weitz. Ben, always love talking to you. Let's continue this friendship. Let's keep sharing the sauce, if you will. And you do a great job. And everybody, just so you know, this guy really cares. He just loves what he does. Retirement is not something he would even consider. I don't think he
Thanks, Rob. I just want to tell people about my contact, if you don't mind.
Sure, do
So
it.
I have a weekly podcast. So check out
Absolutely.
Rational Wellness Podcast on Apple Podcasts, Spotify, YouTube. You can go to my website, which is drweitz.com, drweitz.com, and you can get in touch with me there. So, and you can reach me on social media at Dr. Ben Weitz on Instagram and Facebook and everything else.
Love it. I've been on his podcast. He does a great job. We actually have similar guests. And again, my pleasure. Dr. Ben Weitz, Rob Silverman, Proven Health Alternatives, always yours in health.